Hello everyone, now let us discuss about 2023 ICD-10 coding guidelines for Chapter 15, Part 7. In the current session, we will discuss about guidelines regarding the normal delivery and peripartum and postpartum periods. Now coming to guidelines regarding the normal delivery, which are given by the code 080. The guidelines are encounter for a full-term uncomplicated delivery. The second is uncomplicated delivery with resolved antepartum complication. And finally, outcome of delivery for the O80 series. Now coming to the guidelines, the first one is encounter for full-term uncomplicated delivery. The code O80 should be assigned when a patient is admitted for a full-term normal delivery and delivers a single healthy infant without any complications. It can be antepartum, during delivery, or postpartum. And the code O80 is always a PDX. Code O80 should always be the PDX. It is not to be used if any other code from chapter 15 is needed to describe a current complication of antenatal delivery or postnatal period. This must always be the PDX, and it is not used if any other complication is present, because the code itself describes it is a full-term normal delivery and delivers a single healthy infant without any complications. Whenever complications are there, we should not assign O80 series. Additional codes from other chapters may be used with O80 if they are not related to or are in the way of complicating the pregnancy. Second is uncomplicated delivery with resolved antepartum complication. Patient is having a complication, but it is resolved with an uncomplicated delivery. In such case also code O80 may be used if the patient has a complication at some point during the pregnancy, but the complication is not present at the time of admission for delivery. Previously the complication was present, but now it is resolved. In that case also you can use O80 series. And finally, outcome of delivery codes that come under the category Z37 along with O80. Along with O80, Z37.0, single live birth is the only outcome of delivery code appropriate for use along with O80. Z31.0 is the only outcome of delivery code that is appropriate to be used with O80. No other code should be used along with O80. Now here are the codes for encounter for delivery codes. O80 deals with encounter for full-term uncomplicated delivery. The definition is full term, that is greater than 37 weeks. Delivery requiring minimal or no assistance with or without episiotomy, without fetal manipulation, for example rotation, version or instrumentation, for example forceps, of a spontaneous cephalic vaginal full-term single live born infant. And this code is for use as a single diagnosis and is not to be used with any other code from chapter 15. And additionally, along with O80, you can use the Z37.0 in order to indicate the outcome of delivery. The next code is O82. That deals with encounter for cesarean delivery without indication. This must be used when the documentation does not support the medical necessity for C-section. That is, whenever the C-section is performed for patient convenience, then the code is O82. And use additional code to indicate the outcome of delivery, that is Z37.0. Now coming to the next guideline, that is peripartum and postpartum periods. Here we will discuss what is peripartum and postpartum period. What are the coding guidelines for peripartum and postpartum complications? Pregnancy related complications that are present even after 6 weeks period. And next, admission for routine postpartum care following delivery outside the hospital. And next, pregnancy associated cardiomyopathy. These 5 things we will discuss now. First, coming to peripartum and postpartum periods. The definition is the postpartum period begins immediately after delivery and continues for 6 weeks following delivery. Postpartum means it begins immediately after delivery and continues for 6 weeks following delivery. Whereas peripartum period is defined as the last month of pregnancy to 5 months postpartum. Peripartum means from the last month of pregnancy to 5 months postpartum. Next is complications that arise during peripartum and postpartum periods. A postpartum complication is any complication that is occurring within the 6 weeks period. And now coming to pregnancy related complications that are present even after the 6 weeks period. A postpartum complication is generally referred to any complication that occurs within the 6 weeks period. And the chapter 15 codes may also be used to describe pregnancy related complications after the peripartum or postpartum periods if the provider documents that condition is pregnancy related. If the condition is present even after the 6 weeks and if the physician documents it is pregnancy related, then you can use the codes even in the peripartum or postpartum period. Also, that is after the 6 week period also you can use those codes, complication codes. Next, coming to admissions for routine postpartum care following the delivery outside hospital. Whenever the mother delivers outside the hospital prior to admission and is admitted for routine postpartum care and no complications are noted, the code Z39.0, that is encounter for care and examination of mother immediately after delivery, should be assigned as the PDX. Whenever the mother delivers outside the hospital prior to admission and then admitted for routine postpartum care with no complications, then you need to code Z39.0 as PDX, which is nothing but encounter for care and examination of mother immediately after delivery. Next, finally coming to pregnancy associated cardiomyopathy. Pregnancy associated cardiomyopathy, which is given by the code O90.3, is unique in that it may be diagnosed in the 3rd trimester of the pregnancy and may continue to progress months after delivery. It may diagnose in the 3rd trimester of pregnancy and may continue months after the delivery. For this reason, it is referred to as peripartum cardiomyopathy because it occurs in the 3rd trimester and may progress up to months after delivery. It is called as peripartum cardiomyopathy. And the code O90.3 is only for use when the cardiomyopathy develops as a result of pregnancy in a patient who did not have a pre-existing heart disease. Must be only used in the patient who develops cardiomyopathy as a result of pregnancy and the patient should not have any pre-existing heart disease. Then only we can quote peripartum cardiomyopathy. Now coming to the codes for admission for routine postpartum care following delivery outside the hospital. Z39.0 is given for encounter for care and examination of mother immediately after the delivery. That is care or observation in uncomplicated cases when the delivery occurs outside the healthcare facility. You can use this code as PDX. Next code is Z39.1, encounter for care and examination of lactating mother. For the encounter for care and examination of lactating mother, you need to code Z39.1. And for routine postpartum follow-up, the code is Z39.2. And we all know that code for peripartum cardiomyopathy is O90.3. Now let us see examples. A 27-year-old woman presents for routine postpartum visit. So the code here is Z39.2, encounter for routine postpartum follow-up. Next example, a 25-year-old lactating mother presents with peripartum cardiomyopathy. Here the physician is documenting peripartum cardiomyopathy. So the code is O90.3, which is nothing but peripartum cardiomyopathy. One more example, a 26-year-old patient is admitted for a full-term normal delivery and delivers a single healthy infant without any complications. The code is O80.0, encounter for full-term uncomplicated delivery, followed by Z37.0 to indicate single live birth. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.